I'll talk about pelvimetry today, and the idea about to do a pelvic exam is to gather as much information as is relevant and possible in an effective way, to not fumble around or to need to go back inside to check something else. Yeah, so yeah, personally, I think it was this was a skill that I found super interesting to learn, but having imagined it and gone through it, I actually have little interest to put my hands up in another woman's yoni. But I also know that many women want to have this sort of feedback and information, especially during birth. Cervical opening seems to be like very relevant to many moms. So I'm happy to learn it, and this is what I've studied. These bones are the iliac bones. This is the iliac crest. This part is called the ischium. These are the ischial spines down here. This is the sacrum. The sacrum promontory is this part that comes out, and then we have the arch and the coccyx down here. Here's the symphysis and the pubis and the symphysis. Yeah, exactly. And so in order to do a pelvic exam, we would have first a look at the genitalia. We already discussed with the mother which kind of lubricant she would like to use. We have a look at her vulva for anything that would be unusual, an unusual color or growth. Okay, everything is good. So we will tell her that we will go in with our fingers. We take with 2 fingers. We go in. We feel the cervix like a small bulge, like a nose. Yeah, cervical opening. We can feel it. I found it super interesting that the cervical opening changes forever once a woman was pregnant once. Yeah, then we go in further, we go in deeper, we feel the sacral promontory. We actually feel that, yeah, that there is, that we cannot feel the sacral promontory. That means that there is plenty of space here. Then we go down with our fingers and feel for a curve, for a nice curve that tells us that there is plenty of space. Then we need to make sure that the woman is on a hard ground, or we would put our hand under her to feel that the coccyx is that there is mobility in the coccyx. From there we go to the side. We can feel that in the ischium sideways here we have a nice arch. We turn our hands to feel the space between both ischial bones, ischial spines. Then we can come out. We put our fingers together and turn, and we are coming outwards. And before coming out, we check at the symphysis, this arch, if there is enough space. A usual space would be 3 fingers wide, so there's enough space. We get out, and the last check is to see if there is enough space between her sitting bones. So there is plenty of space for a baby to be born, to come out, down and out.